Welcome aboard, all you wonderful groomers, pet stylists, and canine cosmetologists. You found the Traveling Groomers podcast, where we discuss lessons learned from mobile and house call grooming. I'm one of your hosts, Chris Bear Anthony. Any moment now, we'll be joined by my co-host and friend, retired mobile groomer and educator extraordinaire, Mary Aquendo, and very likely a special guest to help us chat about all things grooming, grooming industry related, and just plain fun digressions that I will totally wrangle back to topic. Grab those travel mugs and climb aboard to see where today's topic will bring us. Let's roll.
Okay, so welcome to another episode of the Traveling Groomers podcast. So we have two special guests today, and our topic is going to be on dealing with reactive pets. So we have Chrissy Neumyer Smith, who is dog trainer extraordinaire, also host of Create Great Grooming Dogs, and Amanda Madtes.
Madtes.
Madtes. Okay, there we go. Almost close enough.
Yep.
Okay, so and Amanda, you have such a dog, correct?
I have two.
Oh, you have two. What breed are they?
One is an American Pit Bull mix, and the other one is a Golden Retriever, believe it or not.
I believe it. And I have two.
And I have one. And Amanda and I have talked about the whole issues and we'll get into that later. But before that, I want to say, because I haven't actually said in a couple episodes, I think, that it's a momentous day because, lovely listeners, welcome to episode 200, recorded on February 11th. And it will be airing on God knows when, sometime in February.
All right.
That's where my head is right now.
I believe it'll be airing on the 22nd, February 22nd.
Sure. That
We'll
sounds
awesome. Episode
like a
200. Date. Congratulations.
Yeah, right?
Yeah. It's a big milestone.
So
Yeah.
I have 4 dogs, and I call them the squabbling siblings. All right. They're also little dogs. You can tell me how normal this is. But one barks, and then there's utter chaos in the house.
Pretty common.
Mm-hmm.
Yeah.
And then my husband screams at them to shut up, which I don't think helps at all.
No.
Because I think from their perspective, it's like, well, Dad's joining in and yelling too. Let's yell more.
Sometimes. It depends on what the barking's about.
Oh,
The why is really important. The reason why they do something is really important.
okay, because a car is driving and making a little noise on the road in front of our house.
So that's the what. But the why is the why. This means this is signal for us to have a great football game with each other. Is it a play thing? Is it a get away from our house because we feel threatened? Is it, oh my God, panic? Is it I'm scared? Is it an excuse to sing the songs of our people?
I think it's an excuse to sing the songs of our people.
Yeah. And then Dad joins in and we're like, he's got a great howl. Come in on the backup, dude. You know?
Yeah.
And the annoying thing is, if it's get away from my house. Oh my God, there's a thing. Do you see that? If it's anything like telling you there's a thing or get away from my house, they're getting instantly rewarded by said thing leaving.
Sometimes it depends.
Okay.
It depends. Did they want the thing to stay? Right. When my guys are like, oh, the mailman's here. I'm pretty sure it's because the mailman sometimes throws a ball, you know? So like for my guys, motivation and the why is always important. And with multiple dogs, they could all have their own separate motivation. I know that makes it more complicated. Everybody wants a quick answer.
Amanda, tell us about your reactive guys, and then I'll tell you about my sad girl.
Got 5 dogs in total. And when I got my miniature poodle, he didn't bark. I thought this was most wonderful. Within 6 weeks, he was up on the back of the couch out the window barking with the rest of them. So I never actually realized that they can learn behaviors at a later age. Two of my dogs are dog on dog reactive. They seem fine. The big guy, the golden, is absolutely fine with a dog that seems to be around 20 pounds or smaller. Anything bigger than 20 pounds, all bets are off. The American Bulldog mix, she came to us with the screw loose. So we actually don't know what goes on in her head. She is the most reactive. She's a bite risk. She has a bite history. When anybody comes to the house, we lock her away. We crate her. We don't do it as a punishment. She gets crated on the daily, or we have the house sectioned off for her. All of them are barkers, and I lose my head sometimes, and I tend to go towards the Irish training method, which is to take a fly swatter and swat it on the sofa or any hard surface near them. I don't hit them with it, and just yell, "Hey," and that's it. They shut up. So that's about it.
A common method.
And I like to say my dog has a screw loose. She's maybe a boxer pit mix. She's in that, we adopted her from a shelter at 6 months old, and we had 3 other dogs and cats at the time, and she seemed to be fine with them. And as she got older, and I don't know if it was we were just realizing more or more as she got older, something would set her off. And she would go from, these are my buddies, I like this cat, I'm going to nuzzle and lick it, to, oh, must kill nearest small thing. And it was sad to see the other animals in the house like look at her and go like, oh, and they'd freeze and be like, shit, she ain't right. And they'd run, but then it's, oh, something is now running.
Run must chase. Yeah.
Run must chase and pin down. And she is crated most of the time now because it's so fast. It is, and the switch gets flipped so fast. Like Cam can have her out between like 11 p.m. and 5 a.m. because nothing's going to happen outside. Nobody's going to ring the bell pretty much between that time. Nothing's going on. But if something happens when she's out during that time, we can be right there next to her and another animal will get injured because it's that fast. Before we even process someone's at the door, it's an issue.
And sometimes that's medical. Sometimes there's a medical component to things like that can be really tricky. And I'm going to say, for anybody who's listening or watching, if you haven't lived with one of these reactive animals, consider yourself lucky, because it's a lifestyle. Yeah. Because I'll tell you, I have 2 dogs, and one of my guys came to me very dog aggressive. They gave him up because he was daily fighting with their lab, and he's 10 now. I got him, he was almost 3. He still looks at labs like, I'm going to assume you're a jerk until you prove you're not. Like, but I can't just send him into a group of dogs, Yeah. We've come a long way, but I will always be watching for everything in our environment. And if people have never had a dog like that, they think it's the owners, and it's not.
And Amanda and I have had conversations about that. And that's why we wanted to bring you in for that, for the outlook and kind of for the validation, because especially in the grooming community, we're so rescue focused, and there's no bad dogs, only bad owners. But if you've not lived with that dog, like I fully think there is a medical issue. There is a screw loose with my dog.
Same here with my crazy one.
Yeah. It's not uncommon for there to be a medical issue. And actually, I think people, especially in the grooming industry, think like, well, I can go to a behaviorist. there are only
Uh-huh.
about 60 behaviorists in the country. They are veterinary specialists, sort of like a cardiologist or a dermatologist. You're not likely to just pack your dog up and go to the behaviorist. It's probably going to be through your vet, but it's a veterinary specialty or a PhD. So it's significantly different than a dog trainer or a behavior consultant, which are sort of like dog groomer and master groomer. Do you know what I mean? That
Yeah.
you have dermatologists if you follow that line, but to have a real workup done by someone who's a veterinary behaviorist I think there are a lot of things that, a lot of medications and stuff that are being used that are really helpful, but that's not what I do, beyond
Okay.
saying there's a medical component. Now, I will say that doesn't mean that there's a magic pill, like there's retraining, there's still so much structure. And anybody who's lived with a dog like this knows like how much structure we live with, there's a lot to it.
It's definitely a sacrifice. And like you
Yeah.
say, a lifestyle, and sometimes not a lifestyle choice. It's, there's been many times where we've had the option of giving up the dog, the main dog, not our golden, now the crazy bitch, we'll call her. We've had the option of giving her up. And at the last moment, my husband has given the reprieve and said no. But it has put a strain on us, our household, when people visit. I used to be able to have friends over and their dogs come over. Now it's an absolute no-go situation. It's just, and I'm not going to lie. There's been times where I'm like, Jesus, why did I get this dog? She was tied to a fence. She was 39 pounds. She's now 80 pounds and lean. And hopefully she's about 12 or 13 years old. I mean, this is horrible, but I keep saying, go to the light, Casey. It's okay. I've given you a great 7 or 8 years. You're fine. You can go.
Yeah.
And that's what people with really reactive dogs struggle with constantly. And I think that through a grooming lens, we see these dogs as like, I don't know why they can't just work on that, but maybe these owners are working on everything. And it's really easy to feel really judged by the whole world that, and I'll tell you what, so I'm a dog trainer and I know what makes my dogs tick. And I've got my Poe dog to a point where I can walk him through crowds of dogs. He competes in fly ball. So he's running full speed past dogs that sometimes he doesn't know. He's had dogs chase him down the lane, but I will always, always, always be on guard for that moment that he's uncomfortable, that like, dude, I'm going to get you out of there. And he has to trust me that that's going to happen. But people look at me and go, I don't know what you're talking about. He's not as bad as other dogs. And I'm like, I work hard on this.
That's because you work with him practically 24/7.
We can't just casually throw a ball at my house without declaring who it's for. I have 2 dogs and they will kill each other if I just throw a ball and they collide, all right, probably not kill each other, but there was an incident with stitches near an eye. So, severe enough.
There will be blood. There will be blood is what you're saying.
Yeah. So, like all of our stuff is like, hey, listen, we're in charge of the game. Brock goes that way, Poe goes that way, and we can run with them and play with them and they have a good time, but there's always going to be management, right? Which is different than training. Management is like when you're like, hey, we have friends coming over. I'm putting my dog in my crate. Excellent. Good management, and maybe they're not a dog that you're going to say, let's work with you with strangers coming to the house because it's not worth the risk, Yeah, right. And the world is so judgy.
And sometimes it's trial and error.
Yeah.
Because with my Una, if I have her in the crate and people come over and are in the room, she will lose her shit and sound like the most vicious thing you've ever had, you've ever seen. If we let her out and let her greet the people, and she's like, oh, okay. But then because we have cats and we have other animals, we still have to put her back in the crate because now she's like, but there's people over and it's, you see it start to creep up and you're like, okay, now but now she is accustomed to the other people in the house. So she can go be in her crate and be chill.
Yep. Yeah.
But if you don't just stumble on that.
I know, right? And that's management.
Yeah.
That's okay. How do I keep you out of trouble? A little
Okay,
bit
and we
different than
have
training.
we have
Management.
all kinds of questions, but we're going to take our first commercial break. If I press the right button. Okay, you know I love my Evolution swivel shears, and you even know that these customizable shears come in non-swivel as well. But did you know that they're the only ones I've been trusting my sharpening with for around 15 years, and that's how we met? What? You haven't tried their sharpening yet? If so, send in your next batch of sharpening and you'll get one shear sharpened for free with a $75 order just for telling them where you heard about them. Your shears and blades will thank you. Okay, and we're back, and I found the right button. So like, Amanda, what things have you found that you have to use to manage? And then Chrissy will, I guess, tell us about that, what we're doing. Hopefully it's right.
And straight up ask whatever you want to do.
Yeah.
Yeah.
Okay, so I found all of her triggers, right? The crazy bitches triggers. One of them
important to know the
is,
why and the what.
yeah, I know it's going to come. So one of the triggers is anything to do with the door. If I'm about to go out the door, somebody's about to go in the door. It's that heightened sense where she turns around. If the 5 dogs are by the door, she'll turn around and she'll nip at whoever it is closest to her. So now I have to back her up, make her sit by herself, let the others out one by one, call their name, let them out, and make her wait until the very end. But once I release her, she's like a bat out of hell. And if there's a dog in her way, she's trampling it. You know, if they're hanging out outside of the door. There's so many things that we've had to do. We've had to separate the entire house into quadrants, you know, so she can be over there without being in a crate, you know, that's Casey's area for the next 24 hours. The grandkids come over, forget about it. If it can happen, it will happen. That's my motto. So prevent it from happening.
Yeah.
So, you know, she's at my work studio. Then if I have to leave, then she's locked out there for 6 hours. It's just a freaking nightmare.
Yeah.
So,
yeah. And it's super complicated to try to figure out like, all right, what's going to be safe, you know, and not everything can be retrained. And I think that non-trainers sometimes think that like, well, can't we just teach her? And some of these things can't be. I'm going to give an example. I like using human examples, but like, let's say we're all at a restaurant and a waiter drops a glass. Most of us just orient to that. We're like, oh, right. The conversational pause across the whole room. And we just orient. But every once in a while, there's that one person screaming. You know, like we see it in people too, that one person who's still carrying on like 2 minutes later. And we're like, is she okay? And they're like, oh, was anyone hurt? You know, and when you think about it, some of our dogs are just like that. They're like, oh, you know, and just super easy to just throw off, easy to just make them go, oh, you know? And when you think about it that way, like, oh God, yeah, we do all know people we would never call for a ride to the emergency room.
yeah.
Right? And that's your dog, man. And I don't know if that helps you at all. For a lot of my owners, that helps them. They're like, oh, right. You know, like that. Sometimes it's a characteristic that can be really hard to work around with a medical component attached to it, you know?
Yeah.
That, you know, for some of our animals, they just are so quick to get over the top. And when you think about like fear, and you think about like the fight, flight, and freeze instinct, you don't get to pick which one you're going to do when you get scared. Okay. So if you get scared, you don't like go, do I want to freeze? Do I want to run? You know?
And it's not always the one you think it's going to be.
No, and it could change in different contexts.
Like I have frozen in a situation and my mind was still going. My mind was cycling through escape options and stuff. But later I'm like, really? My go-to was freezing. My go-to wasn't a knee in the crotch. How was that even possible? Everyone who's ever met me went, you froze? I'm like, shut up. It happens. You don't know.
Yeah, no, and that's true, because you could have, like when my min pin had a heart attack, my initial reaction was to freeze. Okay. But it's the same situation in my mobile grooming van I'm on, that would not have happened, because I'm always prepared for that to happen to me. Right. So yeah,
Yeah.
you can absolutely have different reactions
Mhm.
to
One of my favorite examples is I used to work at a haunted house and I love scaring people. So anyway, this woman's going through with her grandkids. I scared her so bad that grandma took a swing at me. And like I had to straight up block. And she's looking at me going, oh, like the instant that she realized, like, I'm in a haunted house with my grandkids. Why am I trying to hit somebody? She was so embarrassed. But that was the knee-jerk reaction, right? And when you think about, like, we don't pick what we're going to do when we are afraid. So for a dog who is really reactive, sometimes there's a personality trait that you could say is part of that. I'm the woman you would never call if you needed a ride to the emergency room already. And then something scary happens and my body just says, bite the thing next to me. And I'm not saying it's okay, right? But I'm saying that sometimes it's not a choice. So what we end up doing is trying to figure out if there's something that is causing anxiety. Is there something in particular that is maybe the way that the dog's body responds to stress being a little bit over the top? Do you know what I mean? Like their adrenaline response, cortisol levels, like there are ways we can measure stress. And that's where a veterinary behaviorist would come in to say, let's run some tests. Let's find out what's going on with this dog, their endocrine system, like how are all of these hormones affecting them when they are frightened? But you don't really get to choose how you respond. And in some ways,
Chrissy,
I mentioned too, that we mentioned like dogs that are unpredictable. Unfortunately, these dogs are very predictable. They just turn into sharks when something happens. So it's
Chrissy,
exactly predictable.
why
Yeah.
isn't this more common knowledge? You go to the vet with your dog and you tell them, obviously, this is a reactive dog. They never actually push you any further. They push you to a trainer. They never offer up, well, we could try a behaviorist, or we could check the cortisol levels, or whatever it may be.
So I think that part of that is because for many veterinarians, they don't do a whole lot with behavior. So the veterinary, I used to be a vet tech and it was a million years ago, but the vets that I worked with would ask me about behavior stuff because they weren't really well trained on that part. They are likely to say, go to a behaviorist, but I think that a lot of our veterinarians are hearing far too often owners who are saying like, oh, I don't want to, you know what I mean? Like if they try to refer to a dermatologist or something, I try to tell owners, especially owners, to say, I'm willing to go to a vet behaviorist. Like I want answers for this, or a dermatologist or whatever other specialist. Like if you can find the specialist for me, I'm willing to go that route. And I think that most of our vets are like, oh, well, in that case, let's find you a specialist and let's really find out what's going on.
Yeah. Okay. Thanks for that.
Yeah.
So I have questions regarding that, but we're going to take another commercial break. Now that I remember the right buttons, I have to hit. We'll take one, and I have behaviorist questions for you. I love being a house call groomer, but I hate doing laundry or worrying about asking my clients for fresh towels. Raypet has solved those problems for me with the Wet Pet disposable towel, taking up much less space than traditional cotton towels and easy to wring out and reuse. These super soft, comfy, absorbent towels eliminate any cross-contamination concerns between pets. And now their new smaller washcloth size can even help those sensitive eye areas. Great for cleaning out wrinkles gently and thoroughly. Need to keep water bowls for your clients on hand that are easy to disinfect, but hate all the room traditional clanky metal bowls take up? Or just have a very active pet? Their collapsible silicone bowl comes with an aluminum D-ring hook that can be attached to your pet's leash or anywhere else in your van for easy storage. You can get one by itself or in their handy travel kit, along with a set of 3 tick removers and 1 small wet pet towel. So stop by their website to check it out, raypet.net, and tell them the Traveling Groomer sent you. Okay, I know I said I had questions, but I want to actually take my first aggression of the day and defend myself to both Mary, who's looking super pissed at me, and our YouTube viewers, because I understand, Mary, that you are also hungry too. And I feel like a little bit like I'm being cruel eating in front of you.
Yes, she is. It is really
However,
cool.
I would like to point out
Time zones? Is this where time zones come in?
time zones. What time is it where you are, Mary?
6:30 dinner
It's
time.
6:30 p.m. It is 9:30 p.m. where I am, and I have not eaten dinner yet. And I wrestled with 2 Airedales today.
Okay, so then we can go into, well, if it's 9:30 at night, why haven't you not had dinner yet?
I will tell you why. Because I just got home. I started later than I wanted. These dogs take me a lot of time, and they
Okay, and
just
then
moved.
We're gonna break
Wait,
this
wait.
down a little bit. No, we're gonna break this down a little bit.
No.
What time did you get to their house?
I got to their house around 11,
Okay,
and they just moved. They moved outside of my service area. However, they did ask what they could do to bribe me so that I could continue to groom the dogs, because
Dinner.
it's hard to find someone that hand strips. So I got there later than I intended. And originally I was like, oh, I'll be home in plenty of time, but they took a little longer than I expected. I did have snacks with me. They were clearly not sufficient snacks, and things left my head. The reason they're outside of my service area is they're a solid 40-ish minutes away.
okay, so, but I'm gonna say, so you basically were working since 11 o'clock and you did not stop to take a meal.
I did.
A full meal?
Yeah, my full normal lunch.
No, because we're into the dinner. Okay,
Mhm.
so why did you not stop for dinner? Do we have to do like another Care for the Groomer episode?
No, because normally my dinner time is 8-ish. I eat late. So I was wrapping up. My goal was to leave there by 7. And be home by 8. I just ran late because my goal was to be home by 8, eat actual dinner, be here in time for the podcast, not keep our guests waiting, not have an emergency from a friend phone call on the way home that made me pour a glass of wine when I got here.
Oh, now she's trying to make us feel sad.
Yeah, which is like,
Right?
no, she's totally barking up the wrong tree. That might work on somebody else, but
You need
Okay.
to take better care of yourself.
seriously.
Yeah.
Right, but then maybe another,
And I did charge accordingly, but since this is a new house with a new setup, and I forgot to take into account the whole, okay, where are we going to set up? Figure this out. Get the
Right.
tour, look at the bathrooms. Yeah. So
I actually have a question for Chrissy. All right.
Okay.
So when people say the word reactive dogs, I mean, I think there's different definitions that come to mind. Okay. Like
Okay.
my definition with my current dogs being reactive is probably going to be way different than Amanda's definition of reactive, correct?
Well,
would agree
anytime
with that.
anytime someone says their dog's reactive, that just tells me I have a whole lot of questions to ask.
Okay.
Because that's going to be subjective anyway. I mean, that's really subjective. A dog that goes, "What's that?" isn't reactive in my point of view. That's just being a dog, I'd think it was weird if a dog wasn't interested if they heard the door open, like, but it's going to be very subjective. But that's where a trainer or a behavior consultant or a vet behaviorist would be saying, "Oh, okay, tell me more about that." As groomers, there are a lot of questions we can ask if somebody says their dog is reactive about things. There are ways that we can ask some good questions and make sure that we're being safe. So,
All right. Well, give us an example of some questions. All right. So let's just say me and Amanda we're sitting in your office waiting to be seen to have a consultation with you. Okay. What were some of the questions you would ask either one of us to determine on whether my dogs are just being jerks or there's something going on there?
Okay, why don't we go through that now? Amanda, do you want to have an intake session with Chrissy?
Sure. Love
Okay,
to.
we'll get real examples. Okay.
Okay.
go.
All right. So real example, if I'm a groomer and you're coming to me and you're like, well, she's a little reactive or she's very reactive, I'm going to ask you what I call my 4 questions that I want all groomers to know, and pet sitters and anybody else who works with dogs. The first question is, what does your dog do if they don't like something? Because most owners can answer that. Even if it's a subjective story, they have an idea of what their dog will do.
Okay, Amanda, go.
So what does your
go
dog
answer
do if she
that
doesn't
one.
like something?
Let's pick the crazy bitch for this one.
crazy
She'll shake or run and hide or attack. It depends on the thing.
Okay. All right. As a groomer doing an intake, my second question would be, what does she do if she doesn't like something you are doing to her?
Turn and bite. Oh, no, warning, growl first, then bite.
Okay. All right. My third question is, what does she do if you don't stop?
Definitely bite.
Okay. And then my fourth question that I have groomers ask, that I want every groomer to ask, is what do you think she'll do if I don't stop? Because
Oh.
that's when owners go, oh, you're not just going to put a muzzle on and just get this done. You know, like that we're in some real serious, danger. Yeah. So those are my 4 questions, but beyond that, like for a dog trainer and for, more behavior stuff, I would also ask questions like following up with that. When you say she bites, what kind of a level of a bite? Is it a quick air snap? Is it actual causing damage? Has she caused like punctures? Does she grab hold and shake? Does she do multiple bites? Like what kind of bite?
One firm clamp down, targeted in order to draw blood, then releases. And then we'll go again if you don't back off.
Okay. All right. Which to me is a really overreaction. Do you know what I mean? But the thing is that you would have to look at a whole bunch of history too. And only because the things you've described already before we got into these questions, it probably sounds like there's something more medically going on with her too. But there are other times where I would ask someone like, when does this happen? When did it start? That's a good question. Like, when did this start? Is it always been like this?
Territorial. I can actually pinpoint when it started. I used to bring her to work with me when I co-owned a salon in New York. She started to get more and more territorial. So down to the point when the door would open, she'd start barking, and that was just the end of it. I couldn't have her in the salon anymore. I couldn't have her around client dogs. So her days were numbered then.
So my question is, territorial could be part of it. What age was she then? Was she also just maturing into her adult self?
It's hard to say, Chrissy. When we found her, when I ended up getting her, she was tied to a fence. So probably estimated about 2 or 3 at that age. And then about 2 years later, her behavior started to deteriorate to the point of problematic.
Yeah. So about 3 or 4?
Yeah, between 4 and 5, let's say, if I had to guess.
Okay. All right. Because sometimes there are some developmental changes that happen too. Think about us as teenagers, us as little kids.
I was going to ask,
adults.
Could that be hormonal? Because I'm sorry, I just am completely interrupting Amanda, but yeah, mine started around 2 or 3.
Yep. I'm not sure if I would say hormonal because I'm not a veterinarian, right? So like the whole term behaviorist is for veterinarians. However, I would say that there are ages where a dog is going to come into their own as an adult and decide that they want to make some rules. Okay. And that doesn't mean that they're necessarily a bad dog or a pushy dog, but don't we all kind of do that? Like, I have opinions about this. And, and sometimes those opinions really start coming in at about 3, 4, and I got to say, for my own border collies, I have observed and I've I have had 3 border collies in my adult life. And then the ones I grew up with, they matured about 5. So like, I think sometimes we think like 2 or 3 is very adult, but not always, you know?
Have a
Chris-
little digression story. So Sammy was our pit bull, whatever mix. Okay. And when he turned 2 years old, all right, and he was our last unneutered male. All right. My husband is Spanish, and for some reason they equate a dog losing their balls to them losing their balls. But then we got Baby the Chihuahua, and he didn't think that was an actual dog, so we had him neutered. And then it finally dawned on him that that really doesn't make a difference. But anyway, all right. So Sammy turns 2 years old, and he decides he's going to challenge me for whatever it was. He was going to challenge me. And it was raining outside, and I just literally pushed him outside on the deck, closed the door, and the dog hated the rain. And I just sat at the kitchen table, had a cup of tea, read a book, and when I was good and ready, I let him back in the house. And then he was good for a while. And then a couple months later, he tries that again. It also happens to be raining. So I pushed him outside again, closed the door, sat down. So I'm not sure if he thought like I was like this great goddess or something that I could make it rain. And that maybe he better not push his luck with me then, because that was the last time he did that.
You know, it's hard to say. It's hard to say. My last border collie was a really delicate little princess of a border collie. Like, she was not a take charge kind of girl, but she hit 1.5 years. And I remember it so clearly. I was working at an animal hospital. I'm down in the kennel section feeding dogs. They're all barking. She barks too. And I looked at her and said, Isa, hush. And she looked me in the eye and went, whoa, 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 whoa. And I'm like, I opened the door, I told her, what are you thinking? And I put her in a down stay in the middle of the kennel while I walked around and gave everybody else their breakfast. And she's looking at me like, I don't know what I was thinking. But even the dog that you would never suspect would have that little teenager burst, you know, like, oh, you know, that it happens. And I think that sometimes we vilify that little teenager burst.
Yeah, and I think that was with Sammy that, you know, it was like, I'm a man and I'm going to be a man.
I've got opinions. I want to be
Yeah,
inside. What if I just don't do it?
yeah.
What you gonna do? Oh shit, you're gonna make it rain.
We have a story from high school where a friend told a couple other people, like, they can't give us all detention, and their entire class, all 30 of them, got detention. It's like this famous line, like, they can't make us all go to detention. But I think that sometimes there are ages that they go through some of this stuff. And if there is an underlying issue, like a medical issue, it's also going to crop up at different ages, right? So think about that too. And maybe that's just the point where it really became obvious. Sometimes I think in hindsight, we're like, I think it was always there, you know? So just be thinking that it's not about any one thing. It's kind of this combination of things. And especially with our reactive dogs that are really reactive, there's often some sort of a fear basis to it. And I think sometimes we forget that, because when we see a dog being overtly aggressive, it doesn't seem like fear. But what do you become aggressive about? Either you feel afraid or you feel threatened, right? So feeling threatened is a type of fear. I'm not the type of person who's going to back down if I feel threatened. But that doesn't mean that it's not a fear-based reaction. Does that make sense?
Does. Chris, what about the shame of getting a dog specifically for showing or for competing with?
Yeah.
And you can't do either of them.
Yeah.
I got my own
okay.
thing, I couldn't do it.
I'm giving you that finger because I know we've had talks about my current dog. So for the YouTube viewers, that's for Amanda. And that's Irish for I really do actually love you, you bitch.
Yep.
But you know what? We will address that when we come back from our next commercial break. Everything else in the world seems to have changed. Positive Ed has too, but for the better. Online learning is here to stay, and Positive Educational Training has brought the trade show to you with Summit memberships. For one monthly price of $97, you get 6 to 10 hours of content streamed live to your sofa, or let's be honest, grooming table. Forgot to attend live? No problem. You have 6 weeks to watch at your convenience. That's 3 weeks more than non-members, and for up to $50 less than non-members paid. With a monthly support call and summits tailored to the pet industry and designed to include all learning styles, what are you waiting for? Check out positiveed.com today and get the support you need to take action in your business. All right.
I watch my Positive Ed on the couch.
Yes.
That's on the
Yes.
sofa.
First of all, I would like to address the question that nobody asked and say, Amanda, I worked with my boy today and I took him to Lowe's and I went, I'm going to work with having him walk next to the shopping cart because I've had other dogs, Una, my other current dog, who's had major issues with shopping carts. And Alaric went, what's a shopping cart? It's something I walk next to. Didn't care, didn't acknowledge it was there. He gave 0 fucks.
That's awesome.
0.
Good.
So
He's a nice little guy.
he was doing better with not jumping on people until the second time I took him 2 days in a row because I had to return the thing, which I have to return again. Shoot me anyway. And I realized that maybe a decent, not even a long walk, maybe a 10-minute walk before I take him in public to get some of the jumpies down is necessary. But he was still doing decently until one of the employees did the, and I'm like, oh, that's it. It's over. He's jumping on you. And I'm not even going to stop. And I said out loud, I said, I'm not even going to stop him because you just told him to. You just invited him to jump all over you. And yeah, there you go. But so we're not talking about it.
At least you can get your dog into Lowe's. My golden retriever.
Yeah.
We were doing great. I had to run into Walmart. This was when he was a year old and we were still allowed into the training facility. And we had just finished off. Yeah, oh yeah. We'd finished his AKC star puppy training and then on to obedience because I wanted to show him. And one day after training, I had to run into Walmart close by here in Mount Pocono and pick up something. Everything was going great. The photo area that I had to pick something up was just inside the door. He was the perfect dog. And then all of a sudden I hear a growl and there's a 6-foot cardboard cutout of Wonder Woman with her hands on her hips and she's staring down and she's in all of her regalia. The next minute he is full blown running at tilt, leash whipped out of my hand and he's got Wonder Woman on the ground. So that was the beginning of the end.
I'm sorry for laughing. It's not okay. It's funny because it's a while ago and it's not me. Even if it was me, I would be laughing at it at this point because I'm picturing it and I'm picturing that's a very aggressive pose.
It is. Yep.
It's an aggressive pose. She's making herself look big. It's tall. She's staring down. And if he looks up and catches eye contact,
which is exactly what he did. He killed her. He absolutely killed Wonder Woman.
And she's not blinking.
Yep.
So she's maintaining it. She had it coming. I'm just going to say she had it coming.
I would say it might have been a little bit different than that. We might be getting a little anthropomorphic there.
Okay. Okay.
So I saw a silhouette that seemed like it was a human, but it didn't smell human. And it's not breathing. And I don't see any other thing that tells me that that thing's human, but it looks like a human. And you know what I mean? Like that, can't really know what's in their head, but we can't even begin to understand their world of intent, right? So I sometimes I hear these stories and I'm like, I don't think that dog was fooled by a cardboard cutout. Or like when they say like, oh, and we use this stuffed dog to see what he'd behave like with a dog. Like, I don't think dogs are fooled by stuffed dogs.
No.
You know?
No, I don't think
They
so.
can be sort of like thrown off by it. But I think part of the thrown off is dude, that's not a real dog. Like the first time my dog saw a horse, that's not a dog. You may not be aware of this, but that is not a dog.
Well, that's
So
even
something that seems
scarier.
extra alarming. Yeah.
Right. Like when you put it that way, that's even scarier. That's like uncanny valley. Like that looks like a human, but that's not a human. Maybe
Yeah,
he
I'm
was
gonna save us
protecting
from
you
the
from a big
aliens.
monster.
Yes. Yeah.
Yeah.
I mean,
Yeah.
I'm not saying it's okay, right? That's not what I'm saying. However,
Yes.
to say that it was because he thought it was a human he was attacking, or the pose that they were in or something, we really can't tell that. You know?
I don't know why he did it. I honestly
Yeah.
don't know why. He was already
And it was
tired
over the
from
top.
training.
It was
Yeah.
over the top and not okay. So my
Completely.
question is, that was like the first time you saw anything. How long did it take for him to calm down?
Immediately, once I regained control of him, I
Yeah.
about turned and straight out the store, frog marched out the store, and he was absolutely fine. It was
Yeah.
like
Okay.
a flip.
Okay.
But we got
'Cause
kicked out of
that to me-
training then the next week.
I know, right? But sometimes if it's like that super big burst and then calm down really, really fast, that to me is sort of I need to find out from a vet if there's something medical happening. Because usually
Right.
what you'd see is like, holy cow, that's oh, now that you're showing me it's cardboard. Oh, silly me, like that. Usually a dog would take a little bit of time to calm down. If he's like, oh, hey, time to go back to the car. Like that's odd.
Yeah, it
Yeah,
was. It was very strange.
Yeah, and that's where I would say like that needs a medical workup. Like, all right, is there something medically happening? And then also the management that you're already doing wonderfully with, but kind of thinking about like, all right, so figuring out what triggers are. And so when we talk about reactive dogs, have you guys heard the term trigger stacking?
No.
I've heard it from
No.
you. That doesn't
Okay.
mean I remember.
That's okay.
We've
So
never heard it.
imagine that a dog can handle, I'll use some grooming examples. Like he can handle having his ear brushed, but it's challenging. So let's say that challenge, I'm going to use the beginning of the screen, is like about 2 inches tall. A dog that only has like this much ability to handle anything. Maybe he's got like 10 inches worth of, I can handle this before I'm over the top. Okay. Over the top, literally, right? So let's say brushing my ear when nothing else is happening is like a 2-inch challenge. The dryer being on him is a 2-inch challenge, but you stack the two together and you're getting close to the point he can't handle, right? You stack a third thing, a third challenge on top of that. And he's like, this is the worst day ever. The stress of, I just heard a knock at the door. My dog buddy is beside me being whatever they're doing. That one thing your little sibling does that makes you want to brain them every day anyway.
So it's like an
Right?
allergy bucket.
Okay, yeah.
Have you, if you have allergies or have gone to an allergist, it's like an allergy bucket. Like you may be a little allergic to cats, but there's a little allergic to cats and a little allergic to hay fever. And coming in to work and grooming 5 cats and then going out on a high pollen day, you're going to have an issue where you don't have an issue every day.
Yep. Similar.
Or you're allergic, but you have 2 cats and you're fine with the 2 cats. And then when you get a 3rd cat, that's just like way too much cat.
Yeah. Yeah.
Not that we've ever gone through that in my house.
so-
Have I mentioned my husband's a saint? Anyway.
So for instance, my guy Poe, he spent the first 3 years of his life fighting daily with their lab. He has never lost a fight in his life, as far as I know. He's pretty sure he could take on a T-Rex. I have to convince him that that's not his job and come back to me. Luckily, he's all about coming back to me. That's part of his character. I'm taking advantage of it. But if there are a couple of events that happen, like if a dog comes over and growls at him or something, and I know I've just added some, we'll call it stuff in the bottom of the bucket, like that's going to sit there all day. Like that's just primed for the next event that happens. Then the next thing that happens, maybe a dog follows him down the fly ball lane and it's like, we're getting closer, and I don't want to hit the point where he has so many challenges stacked on top of each other that he can't handle it. So that's the process of trigger stacking. And sometimes if we think about all of the things that have happened, for instance, as a house call groomer, sometimes you show up at someone's house and you're like, wow, he's acting really different today. You know, is anything going on? Oh, well, the roofers were here today. Like,
Just
dog has
shoot
been,
me
like,
now.
just barking for 3 hours while people hammer on the roof, and I'm expected to have him be all normal, you know. But now you're adding grooming. Grooming normally wouldn't bother him. The roofers didn't seem to bother him, but you add the same 2 things on the same day, and that dog's like, I can't handle it anymore. Does that make sense?
Yeah, I
Yeah.
had a Springer that I used to groom, and he did not like the process at all. Right. And I would always stop before I could shave like the inside of his ears, but I could not brush his ears. Okay. And as long as we stopped before we hit the brushing of the ears, he did not lose his shit on me.
Yeah.
So-
Yeah. Well, sometimes just, from a grooming process point of view, breaking things up into, instead of it's time to groom your head, and we're going to do all the head stuff all at once. It's like, okay, I'm going to do this part of your cheek, and then I'm going to go back to your hip. Like, we have plenty of dog to work on. So if I have a behavior case, I jump off script and just go around and work around them in a bunch of ways, because otherwise we end up trigger stacking. Because we as groomers are like, it's very efficient to do things in the same order every time. But with our behavior cases, sometimes we need to say, this dog can't handle that. He can't handle my process as it is, that like, it's head time. We're going to do everything head now, because he's got 8 different triggers with his head. If you think about
Chrissy,
trigger stacking. Yeah.
that was so interesting what you're saying, because when I was a groomer, I had a couple of dogs that I could either brush or I could blow dry, but I couldn't do both at the same time. And it took me quite some time to figure this out. And then, I would tell the girls that I worked with, and they were like, oh my God, you're right. If I do this, then take the dryer off of him, just brush him when I need it, put the dryer back on. So that trigger stacking is just I'm after having the aha moment. A couple of years
Good.
too late for me, but thank you. I needed that.
Well, and I think a lot of us notice it, but we didn't know there's a word
Yes.
for it. And once you notice it and there's a word for it, you're able to look for it differently. Like, wait a minute, am I asking for too many things at the same
Yeah.
time? Maybe the
Yep.
brush and the dryer, but then the dog that just got walked into the room, that's all, and he's like, dude, over the top now. The brush and the dryer were hard, but now you just walked sillykins through the room and I am not having it,
All right. I'm going to grab another commercial and then I'm going to come right back and talk about that, because that's now stuck in my head too. And speaking of continuing education, because we either were or will be, join the Andis world-class education team each month for live interactive virtual classes. You'll learn new and trending styles, as well as tips and tricks from some of the best groomers in the industry. Whether you're looking for basic skills, trending styles, advanced techniques, or even just ways to spark your creativity, the new Andis grooming education site is your source for finding what you need to create your way for success. Try new techniques, learn from the pros, and grow your confidence today at andis.com/groomer education. Traveling Groomer podcast listeners, hey, that's you, can get 25% off your first course today with the code VEGROOMING at checkout on andis.com/groomer education. Okay, so I had an aha moment too, because as you're talking about that, I'm going, how many times have we as groomers gone, they were so good until I hit this one thing. They were so good, especially if you've groomed cats. And I have a scar that relates to that. And I wasn't even grooming the cat, but it was, oh, the cat was so good for this. Oh, the cat was so good for this. Oh, the cat was so good. Well, I'm going to try the velocity dryer because the cat was so good for all of these other things. And that was the thing too much.
Yeah. And sometimes the cat or the dog or whoever, maybe the other employee, has been looking like they're pretty relaxed the whole day. But maybe that last thing is just the, oh my God, I can't handle it.
And a
We
lot of
feel
times,
that way, right?
right.
That last customer who's like, but can you get that piece next to his lip? And you're like, lady, you're an hour late. You throw up my whole day, you know?
And you're like, no, I can't. No, I
Trigger
can't. Do it
stacking
yourself. Go home.
affects us. Yeah.
All right. So Cecil, my dachshund mix, is diabetic. He has to get insulin shots twice a day. He's not happy about that. Okay. Now on top of it, he has to also get eye drops. He's not happy about that. He gets insulin twice a day. He has to get drops twice a day. Right? They're gonna get done at the same time. It's enough. He knows it's coming. He gets snacks and treats that high value for it, but he still is not a good patient.
So there are a couple of things that you can do. Sometimes I think we think that giving snacks is going to be like, see, pleasant stuff is happening, but the pleasant might not be pleasant enough, right? But if we also try to address, listen, I need you to be calm before I continue. Like, I really need you to be calm for this. That sometimes they're saying, I'm not ready, and not necessarily refusal, but an I'm not ready. And we continue. My neighbor's, she's shaking her head. My
I'm
neighbor's
laughing at Mary.
Chihuahua, it ended up being the last 3 or 4 months of his life, but he got diagnosed with diabetes and needed 2 shots a day. And she was having a tough time of it. And I did his vaccine, his insulin twice a day for a week. And he just learned, oh, pokes and cheese. He started coming to her at 7 o'clock at night, like, time for pokes and cheese. But it's not just the cheese. It's more about like, can I get you to truly calm down and be accepting while I do this to you? And then we're going to be calm together after it's done. And we're going to eat some cheese while your brothers drool because they don't get it.
Right? On the 8th, he gets his shot. So like 5 minutes to 8, he's looking at me very expectantly. Okay. It's snacky time. I get the really good snacks. So where are they? And will follow me over to the kitchen to where his bowl of snacks is. And then he'll get his first, he'll get a little taste. And then I pick him up and put him on the counter. We still don't have a problem with this. And then I put down the bowl again. And then it's like, oh, you mean I'm going to get a shot too? I don't think so, lady.
Well, and sometimes it's a matter, like I said, of trying to help them be calm about it. The tricky thing about behavior, the interesting thing about behavior is that it's very individual. So every person and every dog as a team are going to have some different answer. You and your husband are going to have different answers with the same dog. And from a behavior point of view, that's fascinating. From the average owner point of view, it's terribly frustrating because we just want to go to like, how do I do this? Page 83, first paragraph, done. And it's just not the way it works. But time and time again, if I can get a dog to truly be calm and I'm like, okay, I'm gonna pinch your skin the way I need to give you the injection. Here it comes. If I can get them to hold still for that and like, here comes the injection. Are you ready? Boop, press, done. If I can get them to be calm for that, it totally changes everything. And everyone's like, but you can't get them calm. The first couple times take a long time. You know, and then the cheese happens after.
Because you know what? He bites. I mean, he doesn't bite hard enough to break skin, but he still bites.
Which are all warnings. You know,
Yeah.
I mean, it's good that he's giving warnings, but we don't want him to bite. Yep. It's tricky. It's tricky. But if you think about the reason why he's biting and stuff, he feels afraid or threatened.
Yeah.
Yeah. And it's scary, especially when they're so little, you know. But really, if you think about helping him be calm for it is more important than the cheese. It's more important than the snacks. I think sometimes we kind of assume that snacks are like I gave you something good, but you could easily train me to dislike chocolate by doing mean things every time I had chocolate.
No way, woman, no way.
I know.
I didn't say coffee. Come on.
But it's basic conditioning when you think about it. It's just negative conditioning. If I got a pop in the face every time I had every time, I took a bite of chocolate cake, it'd still be a long time. But eventually I would be conditioned to not like chocolate cake. So, okay. in that situation, because I was told that a dog can't hold a positive and negative thing in his head at the same time, that I'm just saying what I was told, lady. I see the look.
Well, okay, we can also define, what do you mean by positive and negative?
Well, yeah. Or two different
Pleasant
emotions.
and unpleasant? Are you talking
Yes,
pleasant and
pleasant,
unpleasant?
pleasant and unpleasant. That it's
Okay.
either pleasant or unpleasant. And
Perhaps. We
At-
don't know
at-
that.
at what point do we have to change up the high value treat because if they're not getting calm beforehand, now they're just associating cheese with a poke?
So there are lots and lots of training methods out there, and there are lots of ways to use food. Okay, so food can be used as positive reinforcement, which is when you see a behavior you like and you add food to increase that behavior or maintain that behavior. That's positive reinforcement. Okay, something added, that's what positive means. Think algebra. We tend to think about it as emotional positive, but it's algebra positive. Something added, the plus sign, to
Mhm.
increase a behavior. That's one way that we can use food. Another way that we can use food is negative punishment. Food happens to be out and the dog does something we don't want. We remove the food, sort of like, oh, you're going to talk like that to me? I'm going to take away your phone, right? Ah, like it's a big punishment. I'm not real keen on using punishments. And I know that's going to sound really wishy-washy, but if I can help a dog be calm for me and teach them exactly what I want them to be doing, there's no downside to them following my instructions. I can miss a couple of reinforcements. I can just turn around and go, hey, good job. But if you're relying on knock it off, I said no, the one time you don't do it, they're like, your guard's down, off I go. Most of us are not consistent enough to use a punishment to try to decrease behavior that way. And things that decrease behavior, punishment is to decrease behavior. And it only works if the dog finds it unpleasant, uncomfortable, and or scary. And in dog grooming, the reason they have problems with dog grooming is that they find it unpleasant, uncomfortable, and or scary. So incorporating more unpleasant, uncomfortable, and or scary is likely to backfire for us in those kind of situations, and medical situations too. The reason why a dog is like, why are you putting the sharp thing in me? Sorry, dude, it's your insulin, like they don't understand it. So it's unpleasant, uncomfortable, and or scary. And if instead we try to think about, well, how would I want to be treated? I know that's wishy-washy, but like I would rather have someone say, okay, calm down. This is not going to hurt the way you think it's going to. Are you ready? And I'm going to do the thing. For instance, I'm kind of a sissy about getting blood drawn. And I'll put my arm out there and I'm like, yeah, go ahead and do it. And I'm like, I can't look though. Are you like, I know myself, if someone said, hey, knock it off, I'd be like, okay, no, you don't have my permission anymore. Like, take my arm back. I'm like that, So when we think about helping a dog through it, I think we're more likely to come up with a solution that will make sense for them to actually increase the behavior we do want. Did that answer the question, or did I just make more questions?
Well,
Yes. Yeah, yes. But I'm going to take our last commercial break, and then Mary will ask her question, and then we'll follow back around to something Amanda said earlier and wrap everything up into a very ugly bow. But wait, I have to also remember what button. As a house call groomer, the idea of van and generator maintenance had kept me out of one for years. But Hanvey Engineering and Design has been making mobile grooming vans for 20 years now and has thought of that. No generator to maintain, repair. Sorry, Hanvey, I'll fix that later.
Whoops.
I am, totally fixable. I'll fix it later. Okay, and we're back.
That was quick.
Listen, there are nuances that I'm getting down. It's taking me a minute. I am not too old to learn new technology. I'm
All
just not going to do it fast. How about that?
Okay, so I will work a little bit more with Cecil. If not, I'm gonna like kidnap you and make you come to my house for a week.
Okay.
Are you, Chrissy, you're not coming to the Tacoma show, are you?
No,
Okay.
no. My next show is the Teton show.
Yeah,
Oh,
I'm not bringing
Yeah.
him to Teton.
don't
No,
bring up the
no.
Teton. Well, you're close-ish to yeah. I was going to say, Mary will
That's
kidnap
what,
you
8
after
hours
Teton.
away.
Yeah, that's not
No,
really
no,
close.
it's a 14-hour drive, and now Chris, they're making me drive out there again.
I don't even know
Anyway.
what the drive is for me from New Hampshire, but
Oh, no, it's
Well-
gonna be more than 14 hours.
Okay. And I'm totally editing all of that out.
No, you're not. No, she's not. She's not going to.
you're not gonna edit it out.
Mm.
Edit out Teton Drive. Okay, yeah.
People can't edit out of the video, which is going up on YouTube. So
Son of a motherless goat.
what's the point, Chris?
Edit video. Matter with you guys. Of course you can.
No,
Little
but
20
I
0.2
gonna.
second crossfade. Good. You good to go.
No,
You know what? I'll just start peppering it with crossfades.
No. There is 24 hours in a day, Chrissy. Okay.
Yeah. Yeah. There are 24 hours in a day, and I spend about, okay, this is a solid digression. I had a moment with myself. Do you ever like almost disassociate, and educator Chris started yelling at works too much Chris? Really, because my husband was making me relax and play a video game that I was so enjoying, because I haven't played video games in years because I work so much. I'm like, my relaxation is watching TV with hubby. And then someone that unfriended on Facebook over this, kept posting spoilers to the game.
Oh.
Because of not liking, I'm not getting into it. There's a whole thing, and I understand why some people are upset. However, I was like, I got this one fucking thing, because most of my joys are work related. I got this one fucking thing that's not work related. And she thinks just because she disagrees with something that she can wreck my joy. And I do understand the controversy. But I can separate and compartmentalize this. And then I thought, well, maybe I should have more things outside of grooming. Maybe that's a me problem, Chris. What do you say in your burnout class? Exactly what? Quote it for me. Joys outside of work. Like, I had a moment with myself.
Good. Because you should have things outside of work.
Yes, you should have things outside of work. And I problem is I argue back with myself, and I'm like, but one of my main joys and things that does bring me joy is technically work related. So that's, I think, part of my issue. But yes, I'm gonna play my video game, even if it's a half an hour a day. On the day the game came out, give spoilers anyway.
That's not nice.
It's not nice.
But you do need better work balance.
Yes, I need better work balance. And I understand that if you don't want to support this person, and I can respect that. But if you're upset because you think she's being shitty to a group of people, and your response is to be shitty to a group of people, everybody's shitty here. Reddit, I am the asshole, that has determined that everybody's shitty here. So there is no solving this problem. Anyway, topic.
Better work-life balance. You need to have other things outside of grooming. I went to an orchid show today.
Oh,
I just thought it sounded nice. Like all these flowers. Apparently If you go to an orchid show, my aunt was talking about how she was told to put, to water her orchids with
An ice cube?
an ice cube. Yeah, that's the doodles don't need to be brushed of the orchid world. They're like, oh, again with the
Really?
ice cube. Yeah, hardcore. I'm like, wow. It's the my doodle the purebred of the orchid world.
Oh,
Yeah.
okay.
Every group's got their thing, right? Yep.
And
Yep.
did they also tell you when the flowers fall off, the plant isn't dead?
Yes. Yes.
It's just, yeah.
Yeah.
Okay. Circling back, because that really did make my head explode. And I'd realized, and it made me realize my work-life balance was off and I need to work on that. But one of the things, Amanda, you mentioned earlier, and it's something we've talked about, is the shame you feel when you get a dog for a specific purpose. And not only can you not use it for that purpose, there's issues with that dog.
Mhm.
Yeah, it's
Because
huge.
how many times have
Yeah.
we done that? Maybe not to their face, but mentally to customers.
Oh, a ton. Judgmental freaking Ginny over here.
Yeah. And
Yeah.
the best analogy I can come up with is a few years back, one of my customers was asking me advice on her dog losing weight. And I said, I had all the answers on how to get your dog to lose weight until I had a fat dog. And
Yep.
none of it worked.
It's
Yep.
true. It's true. I mean, some of our owners, and I think being house call, we get to know our owners better. So we actually hear their struggles with these issues. I had a customer whose Yorkie's teeth were horrific, but her Yorkie had terrible health problems and heart problems. So she was worried about putting her under, and having those teeth taken care of. But I took a picture for her so that we could expand it out into like 12,000 times life size. And that's when she really saw, like, this is all just caked on. That's not even your dog's teeth. And she started to cry, that she had no idea. I'm like, oh, this wasn't to make you cry, but the thing was, at that point in this dog's life, that was the healthiest this dog had been in a while. I'm like, maybe it's time to ask the vet again. Like, would this be the time to try it? She did end up trying it. The dog had a bunch of teeth removed and perked up. So we are assuming this dog was in some sort of pain, but it's hard because, it's really easy. The world wants to judge, I'm a dog trainer and one of my dogs likes to jump on people. I try to keep him from doing it, but he's just super, super gung ho. And all it takes is someone to go, but it's so cute. When I tell him like, okay, come on over and sit. And they're like, and he just can't handle it, and he's 10. And it's like, oh, but you're a trainer. It's like, hey, listen, you should learn how to behave around a dog. When somebody says, I'm teaching him not to jump, please don't approach him. Like we all have our own versions. And we have to kind of think about like, all right, well, sometimes our dogs don't live up to the expectation we had, I loved your rally video with your golden doing rally.
Oh, that's
Loved
the
it.
Reactive. They worked
Yeah.
really well with me. I mean, they told everybody else back, keep your dog back, and had him kennel the whole time and in. And that was the first time we've ever even tried something like that. And we signed up for every Tuesday. So fingers
Good.
crossed. Yeah, just to do something with him. He's a beautiful dog, and it's just a waste. I can't compete with them. I got his balls chopped off because I wasn't showing him. I'm like, you don't need those anymore,
Oh.
So,
But maybe you end up doing like rally competition at a small venue that can accommodate that, maybe you end up doing nose work. I mean, there are just so many other ways that we can have fun with our dogs.
You didn't
No,
say
that's
fly
true.
ball. I thought you were going to first thing out of your mouth. Maybe
Dog reactive dogs and flyball. There are a lot of dog reactive dogs in flyball. Flyball is the land of broken toys. I tell you what, because we've got all sorts of dogs playing flyball. Because the drive to run out, get the ball and bring it back, which is over jumps, it's a dog relay race, and like the dogs are off leash, it's chaos and loud. When they fall in love with the game, they're like, getting my ball and nothing's going to stop me. I'm coming back from my tug toy and nothing's going to stop me. And, maybe that's another one to try.
I will definitely, if I come across it, I'll definitely give it a go.
There's just always stuff that I think we want to do with our dogs. And it's really easy for us to think that, especially if for anybody who's never had a dog that's difficult, to say like, well, just try this, it's like, and every once in a while you work with a dog who's like, oh, you mean if you say that word and I lower my bum to the floor, I get a cookie? Dawn. And you're like, I forgot how easy it could be. Some of these super well-adjusted dogs, and you're like, oh, wow. Some of these dogs are so easy. Not all of us have easy dogs.
Thank you. This is not a wrapping up at the end, but I so thank you for validating that, because sometimes there's not as much as we can do as we think we should be doing. But all right, because we're totally going over, but you talked about the behaviorist, and that the actual behaviorist is like PhD level, check their
or a
hormone
veterinary
level.
specialty.
Veterinary specialty.
Yep. Like went to vet school, became a doctor, and then did 4 more years, I think, to become like a cardiologist, a dermatologist, a behaviorist. If it says ist at the end, assume like higher level education, PhD, doctorate stuff.
Now, what stages should we go through? Because I think Amanda and I have both determined at this point that our dogs have medical screws loose. And it's not our fault, but how do we get to that point? Like, do we start with the trainer, and like, where do we go? And how do we ask our vet?
So there are a couple ways you could do that. As a trainer and a behavior consultant, I'll often write something up for a vet. Like I'll work with an owner and we'll write it up, and just write it up in a way that a veterinarian is going to say, oh, this is more than he doesn't like his nails, or he's a little bit weird when people come over, because they're going to hear that as so normal. If we write up like what we think is abnormal, what we observed, what we think the dog needs to know, what our concerns are, then they can say, you know what, maybe we should boost this up to a vet behaviorist. But when we write it up, that's part of it, is being able to write it up and say, this is what we observe, and this is what we've tried, and this dog didn't respond in the way that we expected, because sometimes that happens too.
All right.
This
is Cecil.
Oh,
There we go.
hey, little old man. All right, so Chrissy, are you coming into Groom?
I don't think so.
God
Oh,
damn
come
it.
on.
If you come to Intergroom,
I was thinking about it, but I'm like, I don't know if I can swing it.
I will bribe you with a home cooked meal.
Don't do it. Don't do it.
And you
Don't
can
do it. Don't do
you
it.
can visit your nephew Alaric and my screw loose Una.
There we go. Well, and you can also contact me, because I do lessons over Zoom. I mean, I'm a dog trainer. Yeah. I mean, I can do lessons over Zoom. I do lessons with groomers, working with the dog on their table, like, okay, let's really hash this out and find out what's going on. And, spend some time with that dog on your table through a Zoom call, which is basically having the trainer in the room with you,
That's awesome.
So, yeah, there are trainers out there who do that, but I do that. You can hit me up. I like it.
That's awesome. Amanda, did you have any more questions? Do you feel a little bit better now? I know I feel a little validated.
Yeah, no, I definitely do. Starting to turn things around for him, finding trainers and facility that's willing to work with my reactive dog and allow him to participate in sports while keeping everybody else and all of the dogs safe has been a huge turnaround for me after being, kicked out halfway through training from the other facility. I feel like I'm not failing my dog. I feel like I'm starting to get back on the right track and, get his
Good.
brain ticking over, and
Good.
happy about that.
Well, and it doesn't really go within the scope of this, but there's also something called conditioned relaxation, where you teach your dogs how to calm themselves. And when they
I'm gonna
learn
be
how to
signing up for
calm,
that.
and when they learn to calm themselves a little bit, then you can ask them to be calm when something challenging might happen. You can you can help them become calm after something challenging happens, right? It's just a way to support them. Think about if you were afraid of elevators, what might you do before you went in, and you've got a buddy with you. We're the buddy in this case, like, all right, let's just relax our muscles a little bit, take a deep breath. Are you ready? Let's get in the elevator. I mean, this is the process we do with people, if we can help teach a dog to calm down and relax, and then that's its own process. I know I'm giving you like this 2-second version of,
But now I'm interested.
yeah.
Because we
And-
know it exists,
Because
and
we know it
that there
exists.
are things we can do.
Yep. Because I think we tend to be very reactive to our dog's reactions to reactive land, versus being proactive, right? Where we're like, okay, I know that someone's going to knock on the door because I've got a phone in my hand and I just texted them to do it, and we're going to work on what happens when somebody knocks at the door, things that like setups and stuff, but to help a dog be calm and able to think clearer, if we help them learn to be calm.
Okay.
Okay, she says.
My brain has melted. Sorry. That was not the proper okay word.
Uh-huh.
Uh-huh.
If I
Uh-huh.
can teach my border collies to settle down that way, and they're super active, goofy guys.
Oh no,
Yeah,
that wasn't
chill
that
out,
wasn't
guys, and they're like, oh, yeah.
that wasn't disbelief. That I believe you. But my brain is starting to shut down, and I'm catching glimpses of Mary giving me the
Mary's hungry.
Mary's been hungry, and now
hour.
we're totally worth it, but a half an hour over, and she's just got this frozen like, she's got that mom who's gonna like just wait until we get home.
Yeah.
I'm holding it together in public. Is that my Casey?
Chris is grounded. Oh, the
is-
puppy.
That's my Casey.
Oh,
Crazy bitch.
they're hard to live with, Some of our dogs just are not, super easy to live with. And, I think if you've never lived with one, you don't understand it.
This is true.
It's a sad club, but we're in it.
For the long haul.
Yep. And sometimes, we're just doing our best with a dog that has some physical problem going on, that when they get frightened, when they feel threatened, when they get over aroused, their body takes over, they make bad decisions, or their body makes bad decisions. Sometimes they're not even the one making the decision, so hard to live with, but we still love them. We see all the great stuff that nobody else sees. So everybody was like, why would you live with a dog like that? It's like, because the rest of the time, this dog's my snuggle buddy.
Yeah, that thing is in my bed right now.
Yeah. And I've met Casey, and I think when I was over once, I saw like a minute of the reaction because you were on top of stuff.
Yeah.
But the rest of the time, when she was calmed down, it was like, hi.
Everybody loves her.
Schmoopy face that just goes, the jowls. You just want to go like that.
Jowls are cute on dogs.
Yeah.
Okay.
Cute on dogs.
Shall we wrap this up for tonight?
Yes. Guys, thank you so much for coming super last minute. And I'm going to out myself because I have all this time. I'm totally going to ask them. And they got like zero they maybe got 3 hours notice. And I'm like, you want to come be on a podcast? Shit, I forgot to ask you. So yay, guys, you're amazing.
Not
Thank
a
you.
problem. My pleasure.
It was fun.
All right. So
Anytime.
thank you, and safe travels, guys. Well, that was fun, but now it's time to head home. We hope you enjoyed listening as much as we enjoyed chatting with you. If there are any topics you'd like us to discuss or guests you want to see join us on this crazy road trip of ours, let us know in the Traveling Groomers Facebook page. Don't forget to thank our sponsors, and see you next week, guys. Safe travels.
That was